There's several reasons people can become constipated. Our aged care residents may be dehydrated. They may have inadequate nutrition. There could be an obstruction from a tumour mass. There could be medications that contribute to constipation. A number of different diseases like MND and Parkinson's tend to be causes for constipation for people as well. So we need to be mindful of a variety of reasons that constipation can occur. Constipation can have some quite serious consequences. Anything from the person feeling pain, they might be experiencing nausea, vomiting, which might put them off their food and fluids. We could see things happening like fecal incontinence. We could see fecal overflow, so like a diarrhea. We may see things as serious as a bowel obstruction, and for our aged care residents, we may see things like a real change in their behaviour. When assessing our residents for constipation, we need to look at a range of things. We look at their normal bowel habits. Are they someone who normally has their bowels open every day or every second day? Or is third daily normal for them? The texture of the faeces is important, so if we can have a look at that, that can guide our intervention as well. Again, is it normal or not normal for them? We need to look at the person to see if their food and fluid intake is adequate. Again, has it changed? And why is that? Is it because they're constipated and they're not feeling hungry or they feel nauseated? We need to look at their medications. Have they started on any new medications? Do we know that those medications carry the chances or likelihood of causing constipation? And have we thought about how we're going to manage constipation? Are they showing us that they're uncomfortable? Are they clutching at their stomach? Do they look uncomfortable? All of these things can be part of our basic assessment. Managing constipation starts with some really simple strategies. Ensuring that the person's getting regular mobility if they can. Having a look at their fluid intake and ensuring that that's adequate and what type of fluids are they having. Even really simple things like the position that they're sitting on the toilet can have an impact on their bowel habits. Are their knees a little higher than their hips? Are they able to lean forward a little onto their elbows onto their knees, keeping their spine straight and their stomach out? If medication's needed, we may see that some of our residents are prescribed periods prophylactically to manage their bowels and potential for constipation, or we may need to initiate the use of these medications. We can see a variety of different medications that we may use. So we may have periods that stimulate the bowel, such as Coloxil and Senna. We might see an osmotic, such as Movicol. We might see something that softens the stool, something like Coloxil. And so for our residents that are living with dementia, they may have some specifics to their cause of constipation. It could be as simple as they've forgotten where the bathroom is, or they can't recognise that urge that they need to go to the bathroom. That could be because of the cognitive decline, but it could also be because they have some sensation deficits. So that could be the cause of things like Parkinson's disease or Lewy body dementia. They may be forgetting to eat or drink. They may not be moving around as much as they had previously, so that mobility is really reduced. So for our residents living with dementia, again, thinking of simple strategies that may help these people, we might think about introducing things like prune juice or pear juice, getting them to walk around more regularly as part of their care plan. Putting them or implementing a toileting regime. So we are really monitoring their bowels more closely and aware of what's happening for them. By understanding the causes of constipation and being able to assess and identify constipation and the signs and symptoms of it, it means that we can use some of those simple strategies, but also medications if needed, to ensure that the resident is kept comfortable and that their dignity is preserved.